Good morning, everyone. I'm Michael Chesney. I am a senior communications manager here at Christiana Care, and I am so glad to be able to join you for this Facebook Live with Dr. Marcy Dries, who should be, really need no introduction at this point on our Facebook Live. She is our expert here at Christiana Care on all things pandemic and COVID, and of course, many other things related to infectious diseases. But right now, this is our focus. This is what we want to talk about. This is what is happening in the world. So first up, thank you, Dr. Dries, for taking the time.
Thank you, Michael, for having me back.
Sure. So I want to start broadly. The conversation right now is really around this Omicron variant. And every time a new variant comes up, and people think, oh no, what's about to happen? What are we in for? So let's just start with that kind of broad sense. What is Omicron? Where did it come from? What do I need to know about it?
Sure. So Omicron, first emerged in South Africa, and it was really picked up with when they had, they were at the very low level of the end of their Delta surge. They were at the lowest level they'd ever been throughout the pandemic of COVID transmission, and all of a sudden, in one province, they saw a very sharp incline in new COVID cases, and were very rapidly able to identify this as a new variant, and which subsequently was named by the WHO as a variant of concern, and they named it Omicron. And so how it's different is it has a ton of mutations, more than we've ever seen from any other in any other variant, and it seems to have emerged. It's not like Delta plus a few others. It seems to have emerged, really completely separately from Delta. It's not really very related to Delta at all, or any of the other variants that we've already been seeing. So no one knows for sure where exactly it first actually came from. There's a lot of speculation about, did it come, from a chronic infection in someone that was immune compromised and unable to clear it? But we don't know, and we may never know. But the reason we care about it is, because of the number of mutations that it has. A number of them we already know what they do. They increase transmissibility, or they decrease the effectiveness of monoclonal antibody. But there's a lot of other ones that we don't yet know what, if anything, it does in terms of how it will act in the population.
Can you tell me about maybe back up a little bit, and what is a mutation? And what does that tell us about what's happening when we see mutations in the virus?
Yeah, a mutation is just a genetic change in the code that of what it takes to create the virus. So back in January of 2020, when China first saw these first few cases of what we now know as COVID-19, they released the full genetic code of that virus very quickly. And so we know what it was. And so we can see, every time there's a single genetic change, many of those, and they just happen randomly as the virus reproduces itself. And many of them don't have any consequence. But we know now that some of them have made the virus more transmissible. We saw that clearly with Alpha, and then later with Delta. And they can have other effects in terms of how the virus behaves.
Getting questions in on our Facebook comment section below this, and that's wonderful. Thank you for your questions, and please keep them coming. We get them directly to Dr. Dries. So any Omicron cases yet in Delaware?
Well, as of today, we have not yet heard that we've identified any in Delaware. And all that genetic testing is done at the state public health lab. So they are doing the whole genome sequencing, looking for it. So I know they've been looking. Obviously not every sample gets tested, but they try to do a broad, sampling of all the cases that are identified. There have been cases, I think now in more than half of the US states. Most states have only found one or two, but almost all the states surrounding Delaware have identified at least one. So I think it's only a matter of time before we identify it here. That said, we know that we're experiencing a large surge in Delta, or in COVID cases overall, and that's being driven by Delta variants. So it's not that Omicron is out of control here in this country. We're still, unfortunately, in the midst of a very strong surge of Delta.
So I want to talk about that a little bit more in just a few minutes, but let's start also to go into some of the just newest things that have happened past couple of hours, past day or so. New research out of South Africa showing that it's possible that it looks like the Omicron variant may actually produce milder symptoms and milder cases of COVID, and that from Pfizer that the pills, the antiviral pills the treatment seems to work pretty well. So talk to us about that.
Yeah, so the research, I mean, South Africa has been great in terms of being very transparent of what they're seeing, sharing their data like minute by minute, literally. And so they just released a study that they found that, while Omicron was spreading more rapidly than what they'd seen with their previous surges with Delta, and before that they had a Beta surge, they're not seeing as much severe disease. Now, how much of that we can translate to this country, I don't know. It's probably too early to say. They have a much younger population. They have a lower rate of vaccination in South Africa than we do here, but a higher rate of natural infection. So some of that might be preventing more severe cases. They just have more people that have been infected before. Or it could be a difference in the virus. Viruses often mutate to become less aggressive or less virulent. So we can only hope that that's going to be the case with Omicron. It's a little too early to say for sure.
Yeah, so I think what your point is to take the South African information as valuable, but with a grain of salt in terms of you can't necessarily make an apples to apples comparison between what's going on in their country and what's going on over here.
Yeah, and I wouldn't necessarily count on the fact that it's going to be a milder disease. There's been one death from Omicron reported from the UK. We don't know anything about. I don't know anything about that patient. We will continue to see deaths with COVID. We are seeing more than 1,000 deaths in the United States every day, and they can happen in vaccinated patients. Although usually it's in people that have some underlying medical condition or immune suppression.
Another question from the chat. What should we keep in mind about our holiday plans when it comes to this new variant?
So, I mean, I think, we're certainly in a very different spot than we were last time at this year. Last time we were just getting ready to start vaccination, so people were not protected. And now we have this amazing tool, which is these highly, highly effective vaccines. But things aren't back to normal. We know that our hospitals are full. We're seeing a ton of COVID. So people still really need to be careful. If you're traveling to visit family or friends, to the extent possible, make sure that everyone's vaccinated and boosted. That will certainly maximize everyone's, protection. If there are young children in the mix who can't be vaccinated, then that's probably okay, as long as everyone, all the adults and eligible people around them are vaccinated. If you are, not every family, has the ability to get everyone vaccinated for a variety of reasons. There's testing is more available now than it was last year. So the use of rapid home tests, the day that you're traveling or the day before, as close to that time where you're going to be getting together as possible. We know that those tests aren't perfect, but hopefully they will detect the majority of people that are contagious from COVID. And certainly if you are feeling under the weather, even if it's a mild cold, we know that sometimes COVID presents that way, especially in vaccinated people. Don't travel and don't expose other people if you're not feeling well.
Talk about that a little bit more specifically. You mentioned just then that if you have somebody in your immediate family, and let's say an infant would be a good example here, who can't be vaccinated yet, but it sounds like what you're saying is that having vaccinated people around them creates some level of, a wall a little bit around that. And that to me sounds familiar from experiences with like pertussis, that when you have a new child, you ask you often ask people to get the whooping cough vaccine because the kid can't get it. And so, I think a lot of times we're looking for ways to show that this vaccination, these efforts we have decades and decades of experience doing this kind of thing. Can you address that a little bit?
Yeah, well, I mean, we know there are certain illnesses like flu and like pertussis, whooping cough, that really can be very, very severe for infants under the age of 6 months. and they cannot be vaccinated. So vaccinating every adult who will be around them is the way to protect them. COVID, we know that tends not to cause as severe disease in infants, but it certainly can, especially what we've been seeing with the newer variants, is that kids are more affected than they used to be. And I think, I know a lot of parents are a little hesitant in getting their kids vaccinated. And the thought is, well, kids usually don't get sick. Well, and that's true, but there have been approximately 600 pediatric deaths from COVID since this started. And that, a really, really bad flu year is about 200 deaths. So, yes, by and large, kids will do okay with COVID, but you don't want your kid to be the one that doesn't, right? And it certainly does happen. So as much as we can protect those people, either who can't be vaccinated, if you have a relative who's immune compromised, they may be fully vaccinated, but that vaccine may not work for them as well. So, they need you to help protect them by yourself being vaccinated, masking, not going to, crowded events, where you're exposing yourself and then going to visit them. There's lots of other tools that we can use to protect the ones that we love.
If I've gotten boosted at this point, am I protected from Omicron better? If I'm vaccinated in general, if I've gotten, my first 2 doses, if I haven't been boosted, what do we know and where am I in both those cases?
Yeah, so they've been looking at what's the vaccine effectiveness against Omicron, and unfortunately it is decreased compared to Delta. So they've been estimating that 2 doses of vaccine are probably only 70% effective, maybe even lower, but should still be, they're expecting it to be at least protective against severe disease and death for most people. But then they show that if you go ahead and get that 3rd dose, that booster dose, that you're back up to 90%. So, obviously, we certainly want everyone to be as protected as possible, because even if you don't end up going to the hospital, you could still be sick for a while. And we know that up to 1/3 of people can develop long COVID symptoms, where you could have, sometimes quite debilitating symptoms for weeks and months after even a mild or even sometimes an asymptomatic infection. So we certainly want to, prevent every infection that we can, and getting boosted is the best way to do that.
And I think that's a important message that isn't necessarily always part of the discussion. There are a lot of really serious and very negative outcomes from COVID that aren't death. That's also, we often talk about it in terms of this is how many people have died, but the conversation around the other serious things you can be left with is less out there. So can you just address that even a little bit more?
Sure. I mean, I think, and I think, we see that with young, healthy people for other things too, like flu, that they're the least likely to get flu vaccinated. They've been the least likely to get COVID vaccinated. And yes, if you're playing the odds are that if you're a young and otherwise healthy person, you're not going to get severely ill from COVID, unlike, someone who's over 65 who does have a significant risk of severe disease and death. But, the one thing about COVID that we've learned, I think, is it can be really random. And if you're otherwise healthy, again, the odds are you won't get really sick, but we've definitely seen young, otherwise healthy people in our ICUs and dying from COVID. And you don't want to be that person if it can be prevented. So, that I think, we don't want to be playing the odds. We really want to, protect yourself, not only from the small chance, but not zero chance that you could have severe disease, protect yourself from long COVID, protect your loved ones. Even if you have a mild or asymptomatic infection, the next person you pass that along to could get sick and die.
I want to go back just for a second to the boosters. Recently, 16 and 17-year-olds were made eligible. Should I, as a parent, be, running my kid over to get boosted? What should I know about that update?
Yeah, so just as a reminder, Pfizer is the only vaccine that's currently recommended or authorized for people under 18. And 16 and 17-year-olds were authorized from the very beginning. So some of them, if they were vaccinated early, as soon as, closely after it became available, they're now almost a year out from getting their vaccine series. And we know that immunity wanes, it's really starting at about 6 months. They could be significantly overdue just because they hadn't been authorized to get a booster yet. So if it's been 6 months or more, certainly get them boosted. The 12 to 15-year-olds became eligible in June, and so they could be coming close to 6 months as well. Though currently they're not recommended to get boosted. I suspect that will change, very soon. Like right now, they're not eligible yet because it hasn't been 6 months. So right now, I would just focus on the 16 and 17-year-olds because they clearly, were eligible from the beginning and are likely due for their boosters now. And then certainly for younger kids down to the age of 5, if you haven't gotten them their primary series yet, make sure that you get it for them, because we know that the consequences of getting COVID in this age group, whether it's long COVID or the low but very real risk of severe illness, is definitely more worrisome than the risk of any adverse event from the vaccine.
You say to people who are looking at needing to get a booster, and I think maybe even a little bit of floating around of like, am I going to need another booster after that? That it feels like, boy, they're just going to keep, I'm saying it from this, but they're just going to keep jabbing me. They're just going to keep, like, I'm going to have 15 boosters by the time this is all, how do you address somebody with that concern?
I mean, we hope not. We hope it's not going to be, there's a chance it could become an annual event like a flu shot. I don't think it will. Coronaviruses in general don't mutate as quickly as flu viruses do. So, if we can ever get to the point where we have enough people vaccinated and immune that we shut down transmission, that what's driving all the variants and all the changes is the fact that so many people are just catching COVID, and every new transmission is another opportunity for that virus to mutate. If we can shut that down, then we won't keep seeing quite so many new mutations that might need us to get a new vaccine. That certainly the pharmaceutical companies are working on an Omicron and other variant vaccines, but even the original vaccine that we have right now, just that booster really will protect you. So I can't say no, you're not going to need another one in 6 months or next fall. We just don't know yet. I hope that won't be the case.
You mentioned flu shot just then. I've gotten my COVID vaccine. Do I really need to worry about getting my flu shot?
Yes, absolutely. Obviously, two very different diseases. One does not protect against the other. We saw almost no flu last year, in large part because we really had still shut a lot of things down. Restaurants are restricted. Indoor mask mandates. Lots of public events were not happening. Well, a lot of that has gone away, unfortunately, and so we've already seen more flu just in the first few weeks of this flu season than we did all of last season. So flu is on the rise, and now if you haven't been vaccinated already, now is the time to get the vaccine. And sometimes, again, flu is often also unpredictable, but often after a mild flu season, the next one comes back with a vengeance. None of us have been exposed to flu in the last 18 months, so we don't have that kind of normal population immunity that we would typically have just from being exposed to flu all through the flu season. So that makes the vaccination even that much more important.
You mentioned we're seeing a lot more cases of flu, and flu obviously can be very serious. You tell us a little bit. I think it's just always good to have this be part of the messaging when we talk about this. You tell me about what you're hearing from your colleagues on the floors around the hospitals, and just the significant increase in patients that Christiana Care is dealing with, and many, we're not alone, obviously. But what are you hearing?
No, it's nationwide. Like something like 90% of the counties in the United States are at high or substantial COVID transmission. So it's everywhere, and we are not unique. I can tell you, healthcare workers are exhausted. We're moving into 2 years of this. They're having to wear full PPE for almost every patient because we just don't know who has COVID, who doesn't. And it's exhausting. And especially when, our number of COVID positive patients in the hospital has more than doubled since Thanksgiving. And just the fact that so much of that is preventable is what even makes it that, before when we didn't have a vaccine and it was just happening, it is what it is, and you deal with it. But I think, from a healthcare worker standpoint, it's hard to see cases who are really sick and who are dying when you know that it was probably preventable through something as simple as a vaccine. So, and then, and they're putting themselves at risk. We use PPE and we prevent caregiver infections, and all our caregivers are vaccinated. So we've really shut down, the opportunity for our caregivers to get sick from COVID, but there always is a slight risk. And we certainly want our patients, not to be coming in with COVID if we can prevent it. And certainly, and our volumes of non-COVID things are going up as well. So, people may have delayed care because of COVID, and now they're sicker than they were, a year ago. So it's unfortunate.
I want to take just a couple of more minutes, and I think we can start heading towards wrapping things up. But we talked a lot about kids, and obviously it is true that the people who are most at risk are the older population. But as you've noted numerous times to this point, it doesn't mean that your child, if you have one, can't get very sick from this. So I heard a couple of things recently around pediatric patients and monoclonal antibodies. Can you talk a little bit about that? And can you talk about the antiviral meds and whether kids are able to take them?
Yeah, so first with monoclonal antibodies, so there was a recent change to the labeling. They used to be only able to be given to 12 years and above, and they've now decreased that to younger children, I think down to the age of 6 months. Just recognizing, and these are only used as outpatients in people either who have diagnosed COVID, or they can be used as post-exposure prophylaxis as well. So people who are at high risk of severe disease, like think about your, child who has cancer or undergoing chemotherapy, or a transplant patient, but and others as well, can be used to prevent them from going into the hospital. So that's a good news that we can now treat younger children with that potential therapy. The oral antiviral meds, I think, are very exciting. There's 2 out there that are pending approval, but neither one has been authorized yet. And so they're not available. When they are available, I think they will probably just be for adults, at least to start, until we get more, information about them. So, and I don't have a clear timeline, but it's at least a few weeks away, I think, before the first doses would be available. And then I think similar to all the other COVID therapies, they'll be distributed. The U.S. government has already purchased a certain number of doses. They'll be distributed to the states. They'll be distributed to the healthcare providers. So exactly what the availability will be once they are approved is still a little unclear. But I mean, it's nice to have another tool in the toolbox, but it does not take the place of vaccination. We always want to prevent something as opposed to trying to treat it after.
So that's a perfect segue into the last question I have for you. I'm not vaccinated, and I want to take, I hear about these new antiviral meds. So if I'm that person, and I get sick, why can't I just do that? What's the problem with just saying, well, it looks like there's some stuff out there that'll help me when if I get sick. So, never mind. What's the issue there?
I mean, yeah, I think, it's like I said, it's great to have another tool in the toolbox, especially for people that maybe don't respond as well to vaccine. We never want to try to, use a drug to treat something as opposed to try and prevent it in the first place. Because again, if you wait until you've already gotten COVID, one of these drugs have been shown to reduce your risk of being hospitalized and dying, which is great, but they haven't been shown to reduce the risk of long COVID, of, you're still going to be out for a minimum of 10 days from your life because you'll have to be in isolation, even if you have a mild case. And you could transmit to others. So, why not prevent all of those things with a vaccine? And we now have, hundreds of millions of doses of these vaccines have been given. We know more about these vaccines than we ever have about a vaccine, this early after its launch. And never in the history of vaccinology have we seen, rare side effects come up, years after a vaccine is given. So I know, people are still worried about long-term side effects, but that's not really how vaccines work, because they're in your body for such a transient amount of time. That, I think if that's still what you're worried about, I think it's okay now we're a year into this, you can lay that worry aside and go ahead and get vaccinated.
Dr. Dries, thank you so much. Before I let you go, anything else that, we talked about the holidays, but probably, this is going to be our moment to chat before everybody goes and has their nice time together with their families. Anything else that you think people should know before we end the Facebook Live for today?
Yeah, no, I think, there's this, I get this sense that out in the community, people feel like we're out, it's over, like the pandemic's over, go back to normal. We're so much better than we were. We have all these great tools now that we didn't have before, but we're not quite ready to go back to normal yet. So be careful, of be, safe around your family, protect yourself, protect your family with all the things that we've already talked about. And hopefully, we'll get through the holidays without, too big of a winter surge, and then get through it on the other end.
Great. Well, thank you again. Really appreciate it. Happy holidays to you, and
Thank
happy
you.
holidays to everybody out there. Thank you so much for either joining us live or for watching this after the fact. Have a great one, everyone.
Happy